I think there's been, you know, increasing focus on the needs of people with mental health issues for many many years. I mean, I can actually relate that. When Claire Hinks founded CMHA, actually around the time of the last pandemic in 1918, um, one of his early pitches in 1919 was that there should be parity between mental health services and physical health services. And then in 1963, CMHA National published More for the Mind that identified that in no other field except perhaps leprosy had there been as much discrimination against the patient as in mental illness. And so, really, beginning in the 60s, there was a focus on we've got to begin to do something about mental health care. And More for the Mind did, for example, argue for parity and argue for a shift to services into the community. And then, as we got into the 70s, interestingly enough, when I first joined CMHA in 1975, the following spring, CMHA Ontario Division held a legislative breakfast where they invited MPPs of all political parties to breakfast. And the subject of the breakfast was we actually need to start funding community-based mental health services because there were people who were being discharged from the provincial psychiatric hospitals who had nowhere to go. And the government of the day began with a $5 million grant for the development of community mental health and addiction programs. And it was largely CMHAs across the province that stepped up and began the development of these programs. And then, actually, about 3 or 4 years after that, the Ministry of Health did an evaluation, and they sent out two civil servants to look at what had been created across the province. And the two civil servants, Betty Jean McDonald and Al Erlenbush, came back and said, we were totally amazed at what the community was able to create, because we had the beginning of supportive housing programs. We had the beginning of drop-ins. We had some vocational and employment programs. And I think what we did is we were able to build on that. And then by 1987, CMHA Ontario here in this province was able to convince the Ministry of Health that they needed to do a deep dive into establishing a community mental health system. Actually, one of their staff, Gail Zukar, and I had written a report in 1978 calling for the establishment of a community mental health system. So by 1987, there was some impetus for that. Actually, it was called the hamburger announcement. During the election campaign in 1987, Premier Peterson got onto the campaign bus, gave hamburgers to everybody, the reporters on the bus, and announced that he was going to double community mental health funding. And that created a bit of anxiety amongst the civil service bureaucrats because they had no idea what this doubling of community mental health funding would mean. And so they put a committee together called that published the Graham Report, and I was one of three authors that was able to focus on, what did community mental health look like? What should it look like? Drawing on the work that Gail Zukar had done in 1978, but also looking at what was beginning to emerge in the United States through community mental health centers, and also the notion of engaging service users or consumers and families in the co-design of services. So we actually wrote the Graham Report, and we were able to sort of make a case for building what was called at the time a community-focused mental health system. As a result of that, I was invited into government on secondment, where I was the coordinator of mental health and addictions, and that led to Putting People First. It was published by the NDP government, and much of the funding that they had hoped to invest was curtailed by the recession of the time. But we continued to push. 1999, the Progressive Conservatives are in power. They published Making It Happen, and all these reports built on one another. And the funding continued to grow. I mean, it's well short of what it should be, But we started with $5 million in 1975 province-wide, and we now spend 1.4 billion across the province. So I think what this is, as I said earlier, is that we've been able to build on a notion that mental health is important. The Mental Health Commission identifies that by age 40, half of us will have experienced a significant mental health problem in our lives, and that if we haven't by the time we're 40, in the next 40 years we will. And they estimate that by the time you reach 90, which many of us will now reach, I'm getting closer, 70% of people will experience a diagnosable mental health issue. So it goes from the rather conservative statistic of 1 in 5 to really it's all of us. And it's all of us either at the time, because we're talking about lifetime prevalence, or it affects somebody we know, family or friends. I just did a United Way presentation last week, and both the chairman of the company and the senior vice president talked about the mental illness in their families. Like that wouldn't have happened years ago. So I think what we're doing is we're making advances in terms of people feeling more comfortable talking about mental illness. There's much more focus on it in the community, in the media. Bell Let's Talk has created some impetus for that at least annual discussion about mental health. CMHA has been doing Mental Health Week since the 1950s. So I think there's more focus, more understanding of the importance of mental health. And there's also this notion of the Thrive model, which is the dual continuum model, which says, you can have mental illness and you can thrive in the same way that you can not have mental illness and thrive. So this is all about building social capital and making it possible for people to live meaningful lives and live the lives that they choose. Obviously, people with serious mental health difficulties often need more than just clinical services. They need access to housing. They need access to places like Roots and Pathways where they can get together, and they need jobs. And that's what we've been trying to build. So I think that actually over the 40 some odd years, 45 years I've worked in the sector, there's been greater understanding. But as I said earlier in my answer, the push for parity on mental health and for us as a public to pay attention to mental health actually goes back over 100 years. And it's in the history and it's in the DNA of the Canadian Mental Health Association, the work we've been doing since 1918 across the country.